The pap smear, though it has been a very good test over the course of the last 50 to 60 years, it has a high false negative result. There are women who could have cervical cancers or precancerous conditions of the cervix that the pap smear will not pick up. What we used to do, and is now no longer appropriate, is we used to check for HPV infection only in women who showed the possibility of atypical or abnormal cells on their pap smear. It has now been clearly demonstrated that women can have normal pap smears and have the HPV infection, and in fact reflex testing is not adequate. Abnormal lesions on the cervix or precancerous areas on the cervix are very small, somewhat like a small mole on your skin. If we don't pick those cells up at the time that we do your pap smear screening, or if those cells don't appear on the slide that the examiner is looking at under the microscope, that lesion will be missed and the diagnosis will be missed. And there is some subjectivity to the interpretation of those cells. That is, the same slide could be read several different ways by several different technicians looking at those cells. It is not a foolproof test. Adding the HPV testing does make the chances of picking up the cancer better. The HPV testing does not rely on human error or subjectivity. It's a DNA-based test, so it's much more objective.
I don't feel that women should just rely on the PAP anymore. If there's other technology and HPV test is out there, take advantage of it, use it.
With the advent of the HPV testing in addition to the pap smear, I've informed my patients that if the HPV test is negative and the pap smear is negative, they do not need to have cervical cancer screening done every year. In fact, this can be now done every 3 years. It's very, very important to stress to them, however, that they still should return for their well-woman exam. The pap smear only screens for cervical cancer. It is not a test for uterine or ovarian cancer. They should return on an annual basis for blood pressure screening, breast cancer screening, pelvic exam, including examination of the uterus and the ovaries, as well as a rectal exam in women over the age of 40. It's important for a woman to understand that even if she's received the vaccine for HPV, she's still at risk of cervical cancer. The vaccine only protects against 4 of the types of HPV. She could still become infected with other viral subtypes. Therefore, she should come to the office still for routine cervical cancer screening, which includes a pap test and HPV testing.
If I had a message to share with women, I would tell them that definitely go in for your annual checkups. It doesn't take that long. Go in and have your pap test and have the HPV test done along with the pap. It doesn't take any longer. It could save you from having to go through all the heartache and the time-consuming surgeries that I had to have. It could save your life. It's the best thing you can do for you and your family.